Hi, my name is Dr. Jonathan Berkowitz, and I'm the Medical Director of Northwell Health's Center for Emergency Medical Services. In 2020, when COVID hit and we had several hospitals that were struggling with record overcapacity, we were asked to find a way to unburden our crowded hospitals without evacuating them, and thus further endangering the lives of patients. In the early days of this effort, we were barely able to move just a few patients. But within 2 weeks, we had developed a unique matching market process that was able to transfer close to 60 patients a day. Shortly thereafter, the Fire Department of New York asked us to provide a telehealth option for patients that were low acuity. It had never been done within our infrastructure, and some even thought that this was impossible. However, it was up and running within 2 weeks. This emergency situation served as an important early experiment in telehealth. These experiences taught us that agility and grit are the keys to innovation in healthcare delivery. If we fast forward 2 years, another crisis began attacking the healthcare system, but this time it was not on the home front. When the Russian invasion of Ukraine broke out, Ukrainian doctors were faced with severely limited resources, to the point that it felt as if they were fighting two wars. We were asked to take our COVID learnings and to develop a similar emergency telehealth response in Ukraine. Our answer was, give us 2 weeks. Over hundreds of consults later, across dozens of specialties, we can see the potential of our combination of clinical, operational, and technical excellence. Our physicians are proud to share their expertise. We frequently wake at odd hours to collaborate with our Ukrainian partners on their schedules. Looking ahead, we believe that the frontiers of medicine require more collaboration in order to translate new science into better patient outcomes. Connectivity between patients, families, and providers is fundamental not just to patient satisfaction, but to care. A great example from our efforts in Ukraine was one of our first consults between two maxillofacial surgeons. We had an interpreter as the Ukrainian physician only spoke Ukrainian. But halfway through, the Ukrainian surgeon began to forego the translator, and instead he started pantomiming with his hands to his face. To me, it looked like a sort of strange hand gesture, but our surgeon was able to effectively follow along, and he also began motioning with his hands to his face to explain his thoughts. The surgeons who clearly loved their work and were smiling uncontrollably and were geeking out explaining different surgical approaches, and then came to a decision on the next steps non-verbally. This sort of consult could never have been possible without telemedicine. From our response to COVID to our partnership with Ukraine, we have discovered that the breadth and depth of the Northwell Health system's expertise is able to provide support for any request. It is this systemness that has taught us that medicine is a universal language. Connecting providers to patients, or even to other providers, is at the heart of healthcare delivery, just as much as writing is at the heart of language. Technologies and operations that improve communication and connectivity improve health both within our system and across the globe. We're all in this together, and this is why. Here's a closer look.
Ми приїхали з Миколаївської області, ПГТ Первомайське. Вона почала втрачати свідомість. Може стрес, може.
2 тижні сиділи в підвалі, то безумовно, що це його страх, особливо в неї ще є сестра старша, то вони поки що лишилися там.
Авіації розбомбили всі дома, лікарні, школи і установи всі. Не оставили навіть камушка.
Сталася війна. І ми вирішили для більшої безпеки переїхати на деякий час сюди.
Чудово. Молодець. Ще раз на зелений.
Мій син відчував війну, в нього була тривожність, він постійно рисував ракети. Ми тут ходили до психолога.
Ми маємо їхати конвоєм в Республіку Польща. Кажуть, що в лікарні в Польщі нас там оглянуть ще, ну і потім будуть вирішувати питання, чи нас скеровувати в іншу країну. Ну, мені байдуже, як це все буде. Головне, щоб ми поїхали і щоб моїй дитині надали медичну допомогу. Тато зараз не може поїхати, тому що в нас військовий стан і чоловіків не відпускають. Ну, тобто приходити зараз в будинок, коли нікого нема. Твоєї сім'ї, звичайно, що важко.
Це був мій 6-й день в лікарні, 3 з яких ми не спали геть зовсім абсолютно, тому що в тебе був один конвой, тобі треба підготувати все до того конвою. Конвой був величезний, це було 74 пацієнти і понад 180 всіх людей, які мали поїхати в тому конвої. Це було 3 величезних автобуси, це було 8 швидких.
Місто Дніпро? Дніпро. Вулиця Нарвська.
Чого ми плачемо? Чого ми?
Ляшенька. Перестань. Треба так.
Ви працюєте нон-стоп. І ти тільки лягаєш буквально, щоб хвилин 15 переспати, лягнути, концентрація кави в твоєму організмі просто зашкалює, і тут тобі вже приймальний дзвони, доктор, вас приїхало ще 2 автобуси. І ти така, о, Бог ти мій, що ми маємо далі робити? І ви просто літаєте.
So Dr. Roman, you are a pediatric nephrologist?
Yes.
If I remember correct?
Yes, I'm a pediatric nephrologist from Lviv.
Dr. Roman, please continue.
This patient is nearby me. Her name is Victoria, and on August she will be 12 years old. This girl is ill from the birth. There were some problems with kidney. But 1 year ago, situation with her health started to decrease. We have problems with the liver function. In your opinion, what is better for this patient? To make one moment complex transplantation, or first make a liver transplantation and then make a kidney transplantation, because of we have a family donor.
To clarify, the father is going to donate a kidney and also part of his liver. Is that the plan?
Yes.
Terry, have you seen that? Like that to me sounds like that might be risky for the donor, but I personally don't know about that.
We wouldn't do it at the same time. We did it in series, but we didn't want to take that risk for the donor.
Вікторія, як є тривога в лікарні, людина то все розуміє так само, переживає, то також впливає на голову.
Я хочу навчитися співати, стати співачкою, грати на гітарі. Не боялася, що може десь бути сирена і треба буде ховатися в укриття. А ми тую червону калину підіймемо, а ми нашу славну Україну